Georgia's maternal health challenges are back in the spotlight after a recent statement from the Georgia Medical Board created a lot of confusion for certified nurse midwives and other advanced practice providers. Critics warn the guidance could disrupt care and limit access for patients all across the state of Georgia. So joining us now is Hillary Schneller, Senior Counsel with the Center for Reproductive Rights, to explain the concerns. Thanks for the time here.
Of course. Thanks for having me.
Hillary, for people who don't know what's playing out here, kind of lay out where we are and the concerns because of it.
Sure. So, to take one step back, although nurse midwives, nurse practitioners are highly skilled, independent providers, Georgia has for years required they have oversight agreements with physicians, essentially a permission slip from a physician to practice. To make that work, many providers pay physicians for those agreements. Now, all of a sudden, the medical board has said those payments are unlawful. So that has already really created a lot of confusion, chaos, and canceled care. Providers don't know whether they can practice, physician agreements are being terminated, and patients' appointments are being canceled because of this confusion the medical board has created.
You know, what do you think changed with the Georgia Medical Board's decision? Why the change here for something that's been in place for so long, and for people who were using it, they argue it was working well for both providers and patients?
Honestly, it is a great question. This seems to have come out of nowhere and really doubles down on this physician oversight agreement requirement that already was unnecessary and burdensome. Our client, in a lawsuit we filed challenging the state's very restrictive midwifery laws, including this physician oversight agreement requirement, had to leave the state, had to leave her home state of Georgia because she could not afford to pay a physician for this agreement. Now, what would her option be? If she could not afford to pay a physician the rate they wanted, does the state expect physicians to provide this oversight for free? It really makes no sense. And, as you referenced earlier, the state is doubling down on this requirement during a maternal health crisis, and frankly, during a statewide healthcare provider shortage more generally. It's really, especially in that context, quite indefensible.
You alluded to this just a few minutes ago, but let's dig deeper into the impacts here. This is relatively new, but you say impacts already being felt with patients not being able to access what they need. Can you give us more examples about what's happening in real time and what you expect to happen if this continues to be the guidance as we move forward?
Yeah, I mean, I've already heard that physicians have terminated agreements with nurse practitioners, nurse midwives, because they don't want to get in trouble with the board because of this uncertainty that the board has created. That means that nurse midwives, nurse practitioners have had to cancel patient appointments. And, already it can be weeks or months to get that appointment given the provider shortage in the state. So, kind of bottom line, if the board is supposed to be paying attention to health and safety, which really is its mandate, it is not fulfilling that here. It is making things so much worse and really endangering patients by creating confusion for their providers.
The maternal mortality rate in Georgia is among the worst in the country. And I want to talk more about that in just a second because we're talking about midwives here. But you just made a really important point that we're also talking about nurse practitioners in general. And that can be in so many different areas of medicine, from psychiatric. I mean, it's a wide net that's cast. And I just want to make sure that people understand this. Talk about that part of this. This midwives are a subsection of this that are really important to talk about. But when we're talking about nurse practitioners as a whole, that is a pretty expansive field relative to medical care.
Yes, absolutely. And I mean, nurse practitioners are a critical backbone for healthcare access, especially in more rural areas, including in Georgia, where physicians aren't practicing. So there really is no other alternative provider, right? Nurse practitioners in and of themselves are, again, highly skilled, excellent providers, but they are also meeting a need that physicians are not meeting in certain areas of the state. Nurse practitioners help people enter pregnancy, as healthy as they can, take care of families after, they add more children to their families. So it's, nurse midwives have been the focus for us at the Center for Reproductive Rights, where we're representing midwives in this lawsuit against the state's midwifery restrictions. But the maternal health crisis, those restrictive laws are part and parcel of a bigger healthcare access crisis and healthcare provider shortage in the state that the medical board, again, is not addressing and at a minimum making worse here.
You just mentioned the lawsuit. Where does the lawsuit stand right now, and what would you like to see lawmakers or regulators make a move to do moving forward?
So we filed the lawsuit challenging the state's incredibly restrictive midwifery laws in April, both this physician oversight requirement and the fact that nurse midwives are the only midwives in Georgia who are even lawfully allowed to practice. And then for them, it's incredibly difficult. We filed that in early April. We expect the state's response by the end of this month. And I think this latest policy change emphasizes that the underlying oversight requirement is unnecessary, not advancing patient health and safety, and that the medical board and the state should be using their power and authority to look for ways to expand access to care and not, creating more chaos and confusion and cutting off access to skilled providers.
Supporters of physician oversight requirements often argue they're necessary for patient safety. How do you respond to those concerns for people who've heard that part of the argument?
I just think we have not seen that in reality. Collaboration between providers, between midwives and physicians is excellent. That is what all providers want. It's what patients want. But this mandate to find a physician to quote unquote oversee a midwife's practice doesn't guarantee that collaboration. It does not foster good relationships necessarily between providers. If that's the state's goal, great, invest in that in other ways, but mandating this requirement actually cuts off access to nurse midwives and others in a way the state, should not want.
We have so many conversations about needing more access to healthcare and also the need for more healthcare workers in an industry that struggles to have the staffing it needs. In your opinion, this change makes it harder to get access on both levels?
Yeah, absolutely. I mean, I would definitely be concerned if the state does not rescind this policy, that the state will lose more highly skilled advanced practice providers. As I mentioned, our client Sarah was forced to leave the state. The state lost a nurse midwife because of the pre-existing requirement. This only makes things worse. Nurse practitioners, nurse midwives should not have to practice in such uncertainty where they're afraid the medical board is going to go after them just for wanting to comply with the law and provide care to their patients. There are many other states that are much more supportive of advanced practice providers, and Georgia deserves those providers, but it needs to support and invest in them rather than creating more confusion and barriers for them and for their patients.
Well, we really appreciate the time. It's a regulatory dispute, but it has far reaching impacts to a lot of people and a lot of healthcare providers. Hillary Schneller, thanks so much. And keep us posted on where things go from here.
Thanks.